I want to thank you all for joining our FEMA webinar this evening. We're going to be talking about the Zadroga Health and Compensation Act, which encompasses both the World Trade Center Health Program and the 9/11 Victim Compensation Fund. Joining us this evening we have some honored guests. We have, starting with Anita Arnum, who is Deputy Chief of the Acton, Massachusetts Fire Department and Massachusetts FEMA representative, or leader, I should say, in their task force. We have John Feal of the FealGood Foundation. John, thank you for joining us this evening. And my partners, Dom Penson, Dana Cohen, Lee London, and James Steiner. So we're going to start doing an overview. We're going to start with a short video, and then we're going to talk about the health program and the Victim Compensation Fund and what you should be doing as FEMA responders to protect your rights. And we're really hoping that you're going to be our spokespeople and get the word out there, because there's a strict deadline that you're going to be hearing about, and we really need you to help spread the word about the deadline. So thank you again. Let's start with the video.
The first thing that I hear from the non-first responder community in Lower Manhattan is, look, I'm sick, but I don't deserve anything. I'm not a first responder. I just lived here. I just studied here. I just went to school here. I just raised a family here. Your presence here was an act of courage and resilience. The first responders, I'm in awe. But I also am in great awe of those who came back to a war-torn neighborhood that was clearly toxic. We knew it, but you stayed anyway, and you allowed this area to grow and to become the hub. But it's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member who lived anywhere south of Houston understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
I was on my way to work when the first plane hit. I was working for Goldman Sachs. I actually worked for them for a total of 21 years. I always thought that those programs were geared for the firemen and the police officers, but I'm one of the victims of that.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
My law firm represents over 15,000 people in the 9/11 community. And the majority right now are first responders, but every single day we hear from more and more survivors because we're doing this outreach. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11, or for 24 hours during the month of September 2001, or for 80 hours, which is just 2 full work weeks, between 9/11 and May 30th of 2002. And you need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. I went to school next to Francis. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of World Trade Center toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you. You first responders from all over the country who make up the FEMA task force members, you were breathing the same toxic dust as the New York City firefighters, cops, and ultimately the students who returned to work, the office workers like at my firm who returned to work within just blocks of ground zero. And it turned out that those toxins weren't safe, which is what the EPA first assured us, but they were pretty carcinogenic. As a matter of fact, the bill was named after our firm's client, Detective James Zedroga. Jimmy died of pulmonary fibrosis in 2006 at the age of 34 years old. And when they did an autopsy, they found ground glass, asbestos, chromium, lead, and benzene in his lung tissue. And that was the evidence that NIOSH needed to link what is now 68 cancers and a host of respiratory illnesses. So our job tonight is to just help you understand that you're entitled to the same free healthcare and compensation for illnesses as New York City responders. So up here, you see the map, which Senator Gillibrand referred to in her comments. If you were assigned or you came to work, and I want to make sure everyone understands this, this is for responders who came to the Pentagon, who went to Shanksville and or went to New York City after 9/11. If you were below Canal Street or at any of the morgues or at the Fresh Kills landfill, and you ultimately got sick, well, you're entitled, you're eligible, and you qualify. All right, terrific. So Lee, would you take us through some of the more common illnesses that we've been seeing and that the health program has been reporting?
Sure. So thank you everyone for joining us. And as Michael said before, when the Zedroga Act was created, it was broken down into two entities. You have the World Trade Center Health Program on one side, and you have the Victim Compensation Fund on the other. Both federal programs have been extended to outlive all of us that was in the exposure zone during the time. It is fully funded and extended. And that is a huge reason why John Feal and Michael Barasch lobbied Congress so hard to get this fund extended, because many of these conditions from your 9/11 exposure will be starting to develop now. Skin cancer is one condition that we get called about from first responders every day now. Basal, squamous, melanoma. People don't even realize that skin cancer is a covered condition because it takes that long to develop. Prostate cancer, thyroid cancer. As first responders, as FEMA representatives, you can join the World Trade Center Health Program if you're sick or not. So we don't want people starting this process when they get that oh my God moment. We want them starting it now when they're healthy and when they can go through this program. These benefits are available and we want to make sure that everyone's taking advantage of it. Other than cancer, which is a very big uptake in the 9/11 community, the Victim Compensation Fund and the health program cover many respiratory conditions, GERD, asthma, sleep apnea. And the biggest reason why we want everybody to join the World Trade Center Health Program is so that the program has the research to add new conditions to the list. The 9/11 community suffers a lot from their exposure, and many conditions weren't eligible in the beginning and are eligible now, such as cancer. So we want to make sure, and especially to the retirees that might have came from, we have representatives from FEMA today, from Arizona, from Colorado, from Virginia, from Miami. Everybody responded to New York, to the Pentagon, to Shanksville, and there are World Trade Center Health Program facilities all around the state. So we want to make sure that everybody's covered and that they go in and join the Victim Compensation Fund and the health program. It is a presumption that your cancer was caused by your exposure. You don't have to link causation. If you have the hours and you were there, your cancer was caused by your 9/11 exposures.
Anita, would you please tell us a little bit about your experience? Because I suspect it's very typical of the other FEMA responders who were watching this evening.
Sure. So Massachusetts Task Force 1 was one of the several task forces that did respond down to 9/11. And, obviously we were concerned about things that we would encounter. One of the things I shared earlier today is the fact that most of the photos you'll see of myself on the site, I was wearing my respirator on all of them. And everyone kept asking me, why are you wearing it all the time? Why are you wearing it all the time? And my response was always, I'm not worried about tomorrow. I'm worried about 20 years from tomorrow. And now we're getting to the point where we're approaching 20 years from tomorrow, from that day. And people are starting to develop illnesses. We've lost some task force members. I know other task forces have lost members as well. And people are struggling a little bit with some of the 9/11 illnesses. I had the good fortune to meet Barasch McGarry law firm members in Utah, and they talked about the World Trade Center Health Registry, which we had taken upon ourselves as a task force to get all of our members registered for. But they also talked about the Victim Compensation Fund, which we did not realize was a separate entity that we had to register for. So even while I was sitting in that seminar, I made sure I got registered, and we sent out emails to all of our members to please register for this Victim Compensation Fund. I will tell you from personal experience dealing with Barasch and McGarry, they've been excellent as far as dealing with our members and some of the illnesses. I've acted as a liaison for some of our members who were so sick that they couldn't do it themselves. And Barasch McGarry was right there on the spot, all the information, and helped our members and their families get what they deserved. So certainly appreciate that, and appreciate all the work John Feal has done with Barasch and McGarry as well in getting these acts extended and funded.
One of the things that Anita just mentioned, or I should say Chief Arnum just mentioned, is that just because you're registered in the health program does not mean that you're registered in the Victim Compensation Fund. And that's one of the things we're going to be talking about in a couple of minutes, is this extension of the deadline to register, because so many people, hundreds of people, hundreds of widows have missed the deadline. And thankfully, the special master has extended that deadline. Also, these FEMA entities you see is not a complete list. I just noticed that Indianapolis isn't on this list, and we represent dozens of Indianapolis FEMA task force members who we met in Utah and who have been sent to us over the years. So please, just because you don't see your task force on this list does not mean that you're not covered. Everybody who is in New York, Washington, or Shanksville is covered. Great. Lee, would you take us a little bit through the deadlines to register a claim and the extension which the special master has generously offered the 9/11 community?
Sure. So, this impacts first responders, more than anybody, because just like Anita said before, when the World Trade Center Health Program first opened up, it was a monitoring program. Then it became a treatment program. So with all of the conditions that people responded to and went to for the World Trade Center Health Program, a lot of people are certified with respiratory conditions, GERD, asthma, sleep apnea, and they don't even know it. So one of the deadlines that is approaching, July 29th of 2021, is you have 2 years to file a claim with the Victim Compensation Fund from your date of certification. So what we're finding is that a lot of first responders have been certified for certain respiratory conditions, cancer conditions in 2011 and 12 that they don't even know it, and they haven't registered for the Victim Compensation Fund yet. And this really impacts retirees. It impacts many different types of people that came from out of state and have went back. Dom and Dana are going to talk about a deceased deadline that is approaching, coming up as well, on July 29th of 2021, which really will affect retirees and so forth. But you have to register and you have to ask questions. If they're paying for your medication at the World Trade Center Health Program, you're most likely certified. Two completely different entities, the World Trade Center Health Program and the Victim Compensation Fund, that have different presence requirements as well. So we want to make sure people are going for their appointment and also asking questions, because we want to make sure that if you're certified, you're also registered for the VCF.
All right. Let's move on now to the World Trade Center Health Program, and who better than John Feal can talk about what was necessary. John, I know you're the last person that wants to talk about yourself, but can you just briefly talk about the work that you and John Stewart did? Because the truth is, without a celebrity, I don't think Congress would have acted on this. I mean, John Stewart shamed the congressmen and senators who weren't supporting this for the 9/11 responders. And you were there some 300 times lobbying with your group. So thank you so much for getting both the health program and the Victim Compensation Fund permanently extended. Talk a little bit about that, and then about the benefits of the health program.
Yeah, one, thank you for having me, Michael. Thank you to the panel. Thank you for everybody who's watching this tonight. I'm a member of the World Trade Center Health Program. I get my medications, my surgeries paid for, and I've had 41 surgeries now through the World Trade Center Health Program. It works. It's not perfect, but it works. The VCF's not perfect, but it works. The bill's not perfect, but it works, and we have it until 2090. You know, when this first started in 2005, the World Trade Center Health Program was working on yearly funding from the president's budget. And then in 2010, when we got the bill passed the first time, the World Trade Center Health Program had its own funding where it was able to pay for your prescriptions and your surgeries instead of just monitoring you, giving you 2 aspirins and say, we'll see you in 6 months. We've evolved so much over the years where the World Trade Center Health Program and the VCF are now working together side by side. So if you don't live in New York and New Jersey and Connecticut, you can't get to a center of excellence. The National 9/11 program, which is all over the country, which was founded by Tommy Thompson, the former governor of Wisconsin, LHI, which is located in Wisconsin, they will find you a doctor in your nearest hometown, whether it's a 10-minute drive, an hour drive, but they will do a satellite hookup to New York, and you'll get the best possible treatment if you're sick from 9/11. But here's the thing. Get enrolled in the World Trade Center Health Program now, even if you're not sick. Because if you do get sick, and odds are you will get sick from a 9/11 exposure somewhere before your passing, then you're in the program and it's easier to navigate you through the system, easier for you to get things certified, get surgery dates, and to file a VCF claim, hopefully with Barasch McGarry. So the further we get away from 9/11, it's harder for men and women, uniform and non-uniform, to find an affidavit. And we're asking you to get in the program now and to get affidavits from your colleagues, your coworkers, your bosses, so we can warehouse them. Because now you're seeing people, oh, I was there for 3 weeks, but I don't have anybody to say I was there. They're all dead. We want to help those people that can't find an affidavit, but we also want to help those people that know somebody who passed away because their families are still entitled to this. Look, no one here went to medical school. None of us are doctors, but we know the program works. So don't self-diagnose yourself and take Pepcid or take an aspirin. Get in the program. If you have any illness covered under the bill, it will get certified, and then you'll be able to file a claim and get compensated for it. And this is the National 9/11 program. It's nationwide, and they will find a doctor wherever you go. But here's the thing, even if you're not sick, get in the program. You know, Michael, the average age of the 9/11 responder was 38.6 years old on 9/11. Now most people 57, 58 on average. Just what age humbles you. Things start to break down, things start not to work right. Now add these debilitating illnesses. You have a 40% chance likely of getting cancer before somebody in the general population. Get in the program because you're not only protecting yourself, you're protecting your family. And these lawyers will explain that to you down the road here in a few minutes.
Right. And as you mentioned earlier, you're seeing doctors who see these illnesses, and you're going to hear this over and over again. These are aggressive and in many cases, rare cancers. So you want to be treated by doctors who know what they're seeing and know that there is a link to the World Trade Center toxins. Look, we're living in a really precarious time right now, and COVID is ravaging the entire country. So it shouldn't surprise any of us that the health program has put out a warning that those of you who have respiratory illnesses, those of you who have had cancer and maybe had chemotherapy, you are particularly at risk right now. So please be careful out there. Wear a mask, social distance. This is not a political statement at all. This is what the health program is saying, as you can see on this slide. Please be careful. Lee, would you please talk a little bit about the awards that people get when they're certified by the health program with a 9/11 illness?
Sure. So as I said before, you have the World Trade Center Health Program on one side, and you have the Victim Compensation Fund on the other side, which we would register for both programs, and you move forward at a monetary award for the Victim Compensation Fund. But for the Victim Compensation Fund and the benefits, I'm going to first start out with the most important, because cancer treatment, and when you have a severe respiratory condition, it gets expensive for out-of-pocket medicals. And if you were fighting your cancer in 2008, before it was even covered by the program, you will have out-of-pocket medicals that wasn't covered by your insurance. The health program will not retroactively pay you back once you join the program, but you can make a claim to the Victim Compensation Fund for all of your out-of-pocket medicals and get reimbursed. That is a huge benefit when you're going through chemo treatments. You have that protection. Other than out-of-pocket medical expenses, you have a non-economic loss award for pain and suffering. and that can vary depending on severity. So if you can have non-life-threatening illnesses, such as asthma or sleep apnea, that could range from 20,000 to 90,000. Because you can have two people with asthma, one person uses a nasal rinse once a week, the other person had 5 surgeries for it. So it depends on the severity of your claim. But God forbid anything happens in the future, just because you accept an award for asthma, you do not waive your future legal rights. If you get an award for asthma in a year, and then you get diagnosed with cancer 10 years from now, you can go back to the Victim Compensation Fund, amend your claim for an increased award based on change in circumstance. That is the best part about this fund, and why John Feal and Michael went to Congress to get this fund extended, because cancers and conditions are developing late. You can also make economic loss claims for loss of earnings. I have many clients that get a respiratory condition, then get diagnosed with cancer, and it forces them out of employment. You can make a loss of earnings claim to the Victim Compensation Fund to make you whole again. It is a huge benefit, because the Victim Compensation Fund sees that but for your cancer, but for your respiratory condition, you would still be working today. So I want to make sure that everyone's taking advantage of these benefits. Dom and Dana will speak to the amazing benefits that the Victim Compensation Fund has for wrongful death and estate claims, but you never waive your future legal right by moving forward with the Victim Compensation Fund.
Great. So I want to ask James a question. We've had a number of clients who are really doing badly. They're in stage 4 of their cancer, or their spouse calls us and says, my husband has less than a month to live. What can the Victim Compensation Fund do when there's only a month to go before someone succumbs from their illness?
That's a great question, Michael. And a lot of the reasoning behind that is because when we're talking about these 9/11 cancers, we're talking about terribly aggressive cancers. It's, are commonly referred to as cancer on steroids. And one of the best things about the VCF is that their program allows a claim to be expedited for a claimant who is terminally ill or diagnosed with stage 4 cancer. So typically, when you're looking at a regular claim, it could take anywhere from a year to longer, depending on the nature of the claim. When you're talking about an expedited claim for a terminal patient, what we're really looking at is a claim timeline of just a few weeks. And that's hugely important for so many reasons. And one of the biggest reasons is it allows that victim to have peace of mind, knowing that their affairs are in order and they're taking care of their family, which, as Dom and Dana will tell you about for the wrongful death claim process, is hugely important.
Perfect segue to Dom Penson. Dom, would you tell us a little bit about the death benefits available to the 9/11 community?
Now, Michael asked me to talk to you a little bit about what that claim consists of. On the deceased side, you heard Lee talking about the types of claim, the non-economic loss awards, which is really for pain and suffering, and the economic loss awards that the VCF pays out on personal injury claims. Well, if a family or if a person while alive did not bring a personal injury claim, their family, to begin, can bring that claim. They can get that personal injury claim that Lee was describing as part of the deceased claim. And in addition to that, they're eligible for a variety of death benefits. They can get a second award for their loved one's pain and suffering. Then they can, any dependent of the person who passed away, such as a spouse or children who were dependent, are eligible themselves for direct awards. The family, the dependents, are entitled to something called replacement services, an award for replacement services. So for the cost of replacing the kinds of things around the house or maybe out in the yard, the things that their loved one did for them, for the family, there's an award for that. And any money that was spent, funeral expenses are reimbursable. The VCF will reimburse families for that too. When you add it all up, the personal injury claim, the deceased claim, with all these different categories, these awards can be very substantial. They can add up into the hundreds of thousands of dollars, sometimes into the millions of dollars. So it's very important that we all members of the community, and I'm gonna say it plainly, if you were present in the exposure zone between between 9/11 and May 30, 2002, you should register with the health program, even if you're not sick. Um, and you should prepare your family in case one of these days you pass away from a 9/11 condition. And Dana's going to tell you how you can do that so that your family will receive the benefits to which it is entitled.
Thank you, Dom. More people have died of 9/11 disease than died on 9/11. And that has left thousands of families desperately in need of help. And there is help available. John Feal, Michael Barasch, and others, they fought their hearts out to make sure that that help would be available. They wouldn't take no for an answer. And I want to talk to you about the things that you can do to make sure that that help is there for your family should they need it. More than a third of the families who come to us many years after they lost their loved one because they just didn't know that these benefits were for them. Many people who were there don't know, and the families are even further removed. So what I really want to stress to you is please talk to your family. Let them know that you were there, and let them know that if you pass away from one of these 9/11 conditions, they have a claim. And it's not going to come to them. They are going to have to seek help. Let them know where to go. Let them know where to find that help. Tell them about the presumption. Make sure that they understand that it doesn't matter if you smoked, and it doesn't matter if you're 99 years old, and it doesn't matter if your doctor doesn't make the connection. If you were there and you pass away from one of these conditions that we've been talking about, your family is covered. And make sure they understand that there are strict registration deadlines, there are filing requirements that have to be satisfied. So, they cannot just sit on it.
I wanted to make sure everyone understands this is not an adversarial situation. There's nobody there who's going to cross-examine you and say, isn't it true you were smoking 2 packs a day when you were a teenager and now you have lung cancer? It's not like that. Every hearing officer wants to help you. They want you to be found eligible. They want to make sure that the government gives you the compensation that you're entitled to. So please don't be afraid of doing that.
In the 9/11 community, our biggest adversary is time, right? Time is our adversary because as time marches on, it becomes harder for us to find our witnesses, to get the proof we need. It's there, but time is not our friend. And so one of the things that you must do for your families is get your proof of presence in order. You heard about the affidavits. John Feal talked about them. Those affidavits are critically important to proving that you were there. When your family applies to the Victim Compensation Fund, that is something that the Victim Compensation Fund will have to determine, and they will need those affidavits. If you get them now, your family won't have to. And let's face it, they weren't there with you. They don't know who was there with you in many, many cases, and that can be a difficult task. As lawyers, those families do come to us where nobody got those affidavits, and we will do everything we can to find those witnesses. We have a large client database. We have 20,000 clients. We have contacts. We have connections, and we will track them down. But the process will be much smoother for your family if you do it now.
I'd like to ask Anita a question. Anita, since you were the head of the Massachusetts task force, can you tell us what have you done for some of your members when they came to you and said, how do I prove I was there?
Sure. So since I had the knowledge of your law firm and what you have done, what you've already been doing, when someone comes to me, I've done a couple of things. I've passed along your information so they can get in touch with you. For those that were so sick that they were having difficulties, I would act as a liaison to help them out and work directly with Barasch McGarry's law firm. And we were able to provide affidavits for people. And not only affidavits, but we have, from our task force response down there, we have photos, we have rosters, we have all kinds of documentation. So we've been able to help people in that respect to make sure that they have their affidavits and can get certified with their illness. We've registered all our people to participate in the health registry program or given them information. And as I was sitting here too, I sent out another reminder to all my 9/11 responders. Please, if you haven't signed up for the Victim Compensation Fund, here's the link. Here's what you need to do, and spread the word, because it's not just us as responders, but certainly anybody who has been down in that site.
So Dana, would you go on with some of the other things that should be done now?
Get in the program. Even if you have only a minor illness, register and file a claim with the VCF. If you go through that process with the VCF, your family won't have to. So it'll make the process much more smooth for them. And the last thing is get a will. And that's so important because a part of the VCF award is going to pass through the will. And you and your family, you can decide where that award goes if you have a will. If you don't have a will, it's going to pass by intestacy. It's a formula that the government came up with, and it's a one size fits all, and it does not work for most families. So it might not be what you would want. You get to name your executor in your will. Your executor is the person who will bring the claim. So that should be the person you spoke to, the person who knows that this claim exists and should be brought. That's the person you want to name as your executor. And the process generally just goes much more smoothly for families when there is a will.
One of the things that a lot of the doctors in the health program have been imploring us to do, because they know we do all this outreach, is please tell the women, do not postpone your mammograms. They are deathly afraid of people postponing their mammograms this year during COVID. It's safe to go in for these tests, but if you don't do it, they're afraid they're going to see tens of thousands of women and with breast cancer that could have been gotten early. They're afraid of men and women getting skin cancer that an annual exam would have gotten early. So please, again, take care of yourselves and go for your annual exams. And for men, that means prostate exams if you're my age. Get your PSA tests, okay? All right, so let's take some questions. Hillary?
Yeah, so our first question is, my spouse has stage 4 lung cancer and I don't think he'll make it to next year. What should I do?
This is the classic example of a claim where we would try to expedite. And this is why it's so important for you to warehouse your affidavits now, get your evidence in order. This way you don't have to scramble and if God forbid you're faced with a diagnosis and you're going to have to be undergoing treatment, for you to take an opportunity ahead of time to secure your affidavits or your dispatch orders from Anita or from your task force leader will be so helpful, because that's going to allow us to streamline the process and we can get you compensated from the VCF in a matter of weeks.
I know I am in the 9/11 health program and thought I registered for the Victim Compensation Fund, but I'm not sure. How can I tell if I'm registered?
Yeah, well, I mean, Barasch McGarry could check for you. That's one. Two, you can go to the vcf.gov website and check and type in your name. So, I mean, there's a lot of ways you can check and see if you're in the program. But if you're unsure, you have 5 lawyers here on this call right now that'll be more than glad to help you. And if you have an illness, they'll even help you file a claim.
Right. I can also share with you, those of you who have a pen, you can call the VCF helpline, and that number is 855-885-1555. When you hear the recording, skip everything and just hit 9. That'll take you to an operator. Give that operator your date of birth, and they will tell you if you're in the program, and if so, what your VCF claim number is. If not, you can register yourself, or we'd be happy to do it for you. I want to thank you again, Anita, for helping us organize this event this evening. If anybody else has any follow-up questions, shoot us an email. As I mentioned earlier, we're going to try to answer everybody's questions. We'll do it offline, of course, but I promised everybody that we would limit this evening's webinar to an hour. I want to also thank Fred Endricott, without whom I never would have gotten involved with FEMA. So that was a real pleasure. Thank you, Fred. To John Feal of the FealGood Foundation, you are a treasure to the 9/11 community. Thank you for your tireless efforts. We really appreciate it. Everybody out there, stay safe. And thank you so much.